Thank you so much, Matteo, and thank you to the organizers for the opportunity to present here today. My name is Sharmini Alagaratnam. I am a senior researcher at DNV's Healthcare Research Program. We are an independent global organization with headquarters in Oslo in Norway. And we really work in this space that, Ernst, you have so nicely set the scene for, where we're really looking at how data is valuable and really can be used in a new way because of digitalization, because of the tools that we have today, to really create knowledge and bring benefits both to the individual and society at large. So through our position as an independent third party, we're interested in exploring mechanisms that can promote trust in this kind of ecosystem. I guess we could call it data-driven healthcare. We call it here also citizen-centric health data ecosystem. And one of these is the mechanism of dynamic consent. Let me share my screen for my presentation for you today. Putting that in presentation mode. So we know that healthcare has always been complex. We see here some of the players, the stakeholders in this ecosystem. We have patients, healthcare professionals, healthcare organizations, which we know in themselves are huge beasts with many heads. And of course, we have society at large. And all this entire ecosystem needs to also transition to what Ernst was describing in this, in a data-driven healthcare, shifting to the precision medicine paradigm, where we try to a much greater degree than before to use the knowledge that we have gained from one patient to help the next patient who comes through the door. With the similar presentation. Now, although one could argue that that in fact is the basis of medicine, I think, where we have always used that knowledge to help our next patients, what is different here is the digitalization, which is allowing the use of this data in a completely different scale. And also provides new opportunities such as consenting digitally for the patients, which has been done previously, I would say, in a piecemeal fashion, non-digital. We know that many healthcare organizations the vast majority of them are still consenting on paper for the issues that need consenting to. So we have our team looked at this concept of dynamic consent to look at the value that it provides or potentially can provide. And when we say that, we do mean then a digital dynamic consent. We look through the literature and by piecing that together came up really with 3 hallmarks of dynamic consent, where we believe that dynamic consent can be defined as the option to consent that is presented and can be set through sustainable two-way communications between patients, healthcare professionals, and researchers, where patients or participants have the option to modify their preferences over time if and when they want. And importantly, that the preferences that have been set actually define the basis for the management of clinical data downstream. Now, we also know that dynamic consent is not a new concept. We surveyed the landscape and found a good number of existing digital solutions. So the question for us really was, why haven't these been taken up in greater degree? And to answer that question, we took a deep dive into the field of clinical genetics, which may seem to be a little bit more specialized, but in many ways represents the future of healthcare, in the sense that it is already has needs and is asking the questions, for example, of reconsenting patients, of for the purposes when new knowledge comes about, when new needs to involve patients and inform family members comes about. So for us, it was a way to ask this question in a specific way and get specific answers. We surveyed the literature, we interviewed clinical genetics professionals, and we performed some surveys on their opinions and their clinical experiences. And what that helped us come up with was, in fact, a series of 6 categories of barriers for implementation, which you see on the screen here, as well as some examples of how these barriers could be overcome. I will put the link to our white paper in the chat, but briefly, the 6 categories are ethical, legal and regulatory, knowledge and competence, financial, cultural and organizational, and technological. And I think the take-home message here is that there's a lot of commonalities between clinical genetics and the way we would like to medicine to be practiced in the future. So when looking at all these barriers, what we asked ourselves next was, what are the steps that one could potentially take to start to overcome these barriers in a systematic way? Now at DNV, we have developed an assurance framework called the ADA framework, or Assurance of Digital Assets. This is a methodology that we have been piloting and testing, which allows organizations, users and stakeholders and owners of digital assets, which can be a data cooperative, it can be a consent solution, to look and examine their digital system from various angles in a modular way. So we break these digital objects down into bite-sized fragments and then look at them individually, iteratively, and continuously, by trying to understand what is it that needs to be answered for people to be able to trust that interaction between a digital system and a real-life human being. We have since piloted the use of the ADA framework on a dynamic consent solution. This is the control solution that has been developed by Australian Genomics. So we have entered a research partnership with them, which really recognizes the complex landscape that any dynamic consent solution will need to sit in, and pioneered the use of this approach to look and see how, what risks there are, try and organize them systematically, and prioritize and capitalize on the opportunities that can arise from it. And what does this look like in real life? We have, as I showed you on the previous slide, we have 2 stages in this use of this framework, where in stage 1, we really put the dynamic consent solution under a microscope and reviewed all the documentation around it. We built up an entity map of where that solution sits, all the interactions it has with the different stakeholders, technical, legal, ethical, clinical, patient, societal. We conducted a number of interviews, and really this gave rise to a risk register of risks and opportunities which we're able to identify and prioritize. We then have since started working on the highest priority risk, which we determined with Australian Genomics. And what we're doing now is really to develop an assurance case. And what that means is we're really trying to identify what are the targets here that need trust, and how can we provide evidence for these needs. And again, what does this look like in practice? For this dynamic consent solution, we identified really a number of risks, which we were able to categorize into these three categories. Obviously, a data breach is one big category, but equally an ethics breach, which is the group that we put all the risks in, where the individual's preferences were not, in fact, could not or were potentially not effectuated. And that's what we've called an ethics breach. And also unexpected consequences in these complex systems. The simple act of giving a consent to data sharing can become very complicated when you consent to one issue but not another. How can we make sure that this really is effectuated? And so we're really at the stage now of gathering the evidence, structuring it, and assessing it. And so far, we've had feedback from our partners that this sort of approach, which I could say is a very sort of systems approach to promoting trust and adoption of dynamic consent, has been very valuable to them. But we really shouldn't forget that dynamic consent solutions will really be implemented in complex ecosystems. They are managed by complex organizations. So these challenges need a systems approach to be able to be answered sufficiently. We know that processing of data is governed by security, privacy, ethics, governance requirements. But we believe that the framework that we've developed and are now testing with Australian Genomics is a flexible enough framework that is helping to provide trust in systems such as this. That's all that I wanted to share for now. I'll put the link to our white paper in the chat, and I'm very much looking forward to discussing with you.